Hi, everyone. Dr. Carolyn here. And today I'm going to be talking about something you may not have heard about, reward deficiency syndrome. Now, for most of us, food is a source of pleasure, right? And the source of those pleasurable feelings when we eat our favorite foods or any food that tastes good actually comes from the dopamine reward center in the brain. Now, dopamine is the brain chemical that is responsible for giving us these feelings of pleasure and reward. Anything that provides pleasure affects the dopamine reward center. Now, normally, the brain's hardwiring works in our favor, motivating us to repeat activities that are life-sustaining by connecting those activities to feelings of pleasure or reward. So if something feels good, you want to do it more. That explains why sex and eating are generally pleasurable, because they perpetuate the survival of the human species. However, this mechanism can go awry. Now, food addiction may be explained, at least in part, by changes in the function of the dopamine reward center. For people without food addiction, binge eating, or emotional eating, normal amounts of food provides enough pleasure, and overeating occurs only occasionally. And we know what those occasions are. Thanksgiving is a big one. But if you have a food or eating addiction, binge eating or emotional eating, you may not feel the same amount of pleasure when eating the normal amounts of food. Or when you eat foods that are not your food fixes, as I call them, those foods that you crave and have difficulty controlling. Even eating that isn't really about survival at all, so just eating to nourish your body, can be driven by rewards equal survival dynamic. When you use food to provide comfort or to numb yourself from emotional pain, this behavior locks into the same mechanism that drives you towards life-sustaining activities. But in those instances, it's the need for comfort or relief or numbness from emotional pain that drives you to overeat. You may feel like you're craving a certain food when in fact, you're really craving a certain feeling that you're using food to provide. So I want to say that one more time. You may feel like you're craving a certain food, whether it be chocolate or chips or whatever, but in fact, it's not about the food. It's about the feeling that eating that food gives you. And then you end up, so once again, the result is that you're obsessed with eating and you may binge on foods that modify your emotions. So that's how food is being used as a way to change how you feel. Reward deficiency syndrome involves a failure in the brain's dopamine reward center. Now, researcher Kenneth Blum described reward deficiency syndrome some time ago, and he defined it as a syndrome defined by difficulty experiencing feelings of pleasure or satisfaction. So if you have reward deficiency syndrome, your brain has a harder time detecting the pleasure signal carried by dopamine, leading you to want to turn up the volume by either eating more food or eating more of those food fixes that give you that feeling that you're looking for. Low dopamine D2 receptors in the brain may make you more prone to emotional eating and to binging. Now, underlying dopamine regulation issues may explain why many people with binging behaviors and food addiction have a higher risk for another addiction, whether it be gambling, sex, alcohol use disorder, drug addiction, etc. You may have read about individuals who have had weight loss surgery, for example, only to develop another addictive behavior like alcohol use disorder, gambling, or sex addiction. So I'm going to put in the show notes a little quiz to give you information about information to help you determine whether you may have reward deficiency syndrome. So let me just go over the quiz right now. Do you have RDS? Number 1, playing poker is more fun to you than playing chess. Number 2, you enjoy high risk or adventurous activities. Number 3, given the choice between getting a small reward now or waiting for a larger one later, you prefer not to wait. You want it right now. Number 4, most people describe you as having an excitable personality. And number 5, at work, you just can't get your job done without coffee. So if you answered yes to 1 or 2 of these questions, you may have mild reward deficiency syndrome. If you answered yes to 3 or more of the questions, you are highly likely to have reward deficiency syndrome. So learning about RDS can help you understand why some things are harder for you than for other people. You know, when you're in the coffee shop or in your employee lounge and you see someone, Janie, across the way eating the lemon frosted pound cake, and she doesn't seem to gain a pound, whereas you feel like you're if you started eating that pound cake, you really wouldn't be able to stop. That's the difference between someone who has reward deficiency syndrome versus someone who does not. So a better understanding may help you relieve some of the suffering you've experienced in constantly trying to change your impulsivity and compulsivity and feeling as if you're getting nowhere. If you understand that some of these behaviors and traits are related to reward deficiency syndrome, you can begin hopefully to accept and then find ways to work with the cards you've been dealt instead of working against them. So to learn more about reward deficiency syndrome, check my upcoming podcast on RDS, and the next newsletter, we're going to be talking about the causes of RDS and what you can do about them. So I just want to ask you to also remember that we have a anchor program starting soon, and that the anchor program is a non-diet coaching program for women with binge eating disorder, food addiction, and emotional eating that helps you get to the root cause of why you are struggling with these issues. And as I mentioned today, reward deficiency may be a symptom of the root cause. And we're going to talk about what the true causes are of RDS next time. All right. Thank you.